Dr. Ken Landau, thanks for watching. Let's talk about calcium supplements. A lot of people are taking calcium supplements. Estimated maybe a quarter of younger men and 50% of older men, a third of younger women, 2/3 of older women. Calcium supplements are available as chewable tablets or capsules or liquids or powders or antacids. You can take them as Tums or Rolaids. They have calcium. It's supposed to be a good idea to get sufficient calcium. Diet, obviously, is the best source because you take small amounts spread throughout the course of a day, and you take it in combination with other nutrients. You don't take it as a pill that you take just once a day. Actually, if you take calcium supplements, you can't absorb any more than 500 milligrams at a time. So if you take 1,000 milligrams of calcium, you're not getting any more than 500 milligrams. The whole concept of supplements for calcium started in the 1900s, and now it's grown into $1 billion industry. That's with or without vitamin D added. So calcium carbonate, that's a very popular supplement. It's 40% calcium by weight. Elemental calcium tends to be around 200 to 400 milligrams in a tablet. It's the least expensive way to get the calcium supplements. It requires stomach acid to be absorbed, so you have to take it with food. It can neutralize stomach acid. Actually, can be found in some of the over-the-counter antacids like Tums and Rolaids. You can buy calcium supplements at any grocery store, Oscal or Caltrate, or just substances labeled calcium. There's calcium citrate too. Calcium citrate only has 21% calcium by weight, but you can take it with or without food because it doesn't require acid to be absorbed, which is important for older people because the amount of acid that you produce after age 50 tends to be relatively low. It's more readily absorbed if you're taking other heartburn medicines like the proton pump inhibitors or Tagamet or ranitidine. Also is absorbed if you happen to have something wrong with your gut, like you have inflammatory bowel disease or an absorptive disorder. Lots of different products available containing calcium citrate. But be careful, don't take the unrefined oyster shell calcium, don't take the bone meal or the dolomite, don't take the coral calcium. All of those can contain other substances that might actually be harmful. There are also other kinds of calcium, but they don't contain enough. So calcium gluconate only has 9% calcium, calcium lactate 13% calcium. If you're going to take a calcium supplement, you should wait several hours before you take either iron or zinc or tetracycline or thyroxine. And it's a good idea if you take a calcium supplement to look on the label and make sure that there's some sort of an emblem that shows it's been tested by an independent agency like Consumer Laboratories or USP or NSF or the Natural Products Association. All of those certified that at least the manufacturer is proper. The appropriate practices have been undertaken, and the product is going to be broken down and released in a specified period of time without any harmful lead in it. It's not guaranteed that it's safe and effective or it's valuable. You can actually do one of your own tests. You can take a little lemon juice, and you can put the calcium pill in there, stir it occasionally, and look to see if it's dissolved in 30 minutes. If it is, then it's probably going to dissolve in your intestine. Well, if you're going to take the calcium supplements, and if they're going to do any good, you have to take at least 80% of the doses. So you have to take it at least 80% of all of the days. Most people only take it about 50% of the time. And even given the best of circumstances, that's probably not going to be adequate. Now, how much calcium do people get in? Well, if we look at the diet and the supplements, women are taking in on average between ages 20 and 40 about 1,400 milligrams a day. Women over age 40 are taking in about 1,600 milligrams a day, and men are taking in even more. Now, if you're going to take a calcium supplement, it's going to interfere with bisphosphonates if you happen to be taking a drug like alendronate, Fosamax, for your osteoporosis. You can't take the calcium at the same time. Same thing if you're taking the Cipro or the Levaquin, can't take it with calcium. Can't take tetracycline or thyroxine or dilantin at the same time. Going to interfere. Now, sometimes when you take a calcium supplement, you could have some gastrointestinal disturbance. And it's shown that if we give a group of people either a placebo or a calcium supplement, we're going to have about 10% of gastrointestinal complaints in the placebo group, and we're going to have about 14% complaint in the calcium supplement group. So there's a 40% more likelihood of gastrointestinal problems, especially if you take the calcium carbonate rather than the calcium citrate. The GI problems, constipation, diarrhea, gas, nausea, vomiting, dyspepsia, abdominal cramping, and bloating. And if we look at people admitted to the hospital for acute gastrointestinal symptoms, well, they're more likely to be taking the calcium than the placebo group. If you take the calcium carbonate, you might have an acid rebound if you stop, might not be associated with the calcium citrate. Everyone seems to agree that if you take the calcium as supplement, not calcium from your diet, but calcium as a supplement, you're going to increase your risk of kidney stones. There's conflicting evidence whether you're going to increase your risk of coronary heart disease, stroke, and cancer. So if you take a calcium supplement, not calcium by diet, but calcium as a supplement, you're going to increase the amount of calcium in your urine, and you're going to increase the likelihood of a kidney stone by about 17%. The kidney stones tend to be calcium oxalate. Most of the studies have shown that the association is just with the supplements, not with the diet. Women's Health Initiative, looking at 36,000 women, following them over time, many years, found that the rate was indeed increased 17% for the kidney stones, but there was no decrease, by the way, in the number of fractures. So more stones, not fewer fractures. The Nurses' Health Study, again, showed the same positive association. You take the calcium supplement, have a higher risk of the kidney stones. And it looks like the longer you take the calcium supplements, the higher the risk is. Everything was fine then until about 2010, when Boland from Australia, he evaluated a group of women and found actually about a 27% increase compared to placebo in the incidence of heart attacks in women who were taking calcium supplements. And when you look carefully at the data from the Women's Health Study, in the women who started taking calcium at the start of the trial, women who weren't taking calcium supplements before, but started at the onset of the trial, they actually had a 22% increase in their risk of heart attack. Journal of the American Medical Association, JAMA, Internal Medicine, following people in a study for 12 years, 20% increase in the cardiovascular disease death rate. Might be just in men, might not. Swedish study looking at people taking more than 1,200 milligrams total intake a day, increased coronary heart disease. Boland's work was reevaluated by other groups, and they said, nah, your data is a little bit off. Actually, there's a 45% increase in coronary heart disease, even though that's not statistically significant, according to them. Well, the Kuopio osteoporosis study, which was a randomized control study in Finland, looking at about 10,500 women, following them for 7 years, those women who were taking the calcium supplements had a 24% increase in their incidence of coronary heart disease. And if we look just at postmenopausal women, following them for 5 years, there was at least a 12% increase in ischemic heart disease. Now, other studies have shown that there's no change in the rate, and according to the National Osteoporosis Foundation, there's absolutely no relationship. The Iowa Women's Health Study found that those women who were taking the calcium supplements had a decreased risk. So the studies are inconsistent. No study has been primarily associated with looking for coronary heart disease. But we can say that the studies, when we look at all of the studies together, it would appear that there's a fairly good probability that the calcium supplements might increase the incidence of coronary heart disease, might increase the incidence of stroke somewhat less. Now, we do know that if the serum calcium, the amount of calcium inside the blood, is high, that's going to lead to an increased incidence of calcification, coronary artery calcification, which obviously isn't too good. And there's a positive correlation between the serum calcium level and ischemic heart disease. As far as the colon is concerned, Well, we have conflicting evidence there too. No studies specifically looking at the incidence of colon tumors in people taking calcium supplements. But in the studies that were done, it was found that calcium carbonate might decrease the risk of adenomas in the colon if people took 700 to 800 milligrams of calcium a day. Other studies were inconclusive, and other studies showing at more than 900 milligrams of calcium a day that the incidence of colorectal cancer actually increased twofold. Good news is that looking again at that Women's Health Initiative, the largest study looking at 36,000 women followed over a period of time, taking a 1,000 milligram supplement of calcium and 400 units of vitamin D for 7 years, found that there was no change in the invasive colorectal cancer in the group taking the supplements versus the group not taking the supplements. But there is a study that shows that the incidence of aggressive prostate cancer seems to be increased in men taking over 1,500 milligrams total intake a day versus men taking an intake of between 500 and 1,000 milligrams per day. Now, if we look at people who are taking excessive number of Tums, that's calcium carbonate, each tablet has about 200 milligrams of calcium in it, they can develop the milk alkali syndrome, increase the serum calcium a bit, end up with renal failure, and along the way, poor appetite, and dizziness, and headache, and confusion, and dry mouth. It's reported with as little as 5 Tums per day. That's 1,000 milligrams of calcium. So we always have to look at the risks and the benefits. Well, the benefit supposedly is going to be if you take the calcium supplements, you're going to have a reduced incidence of hip fracture. Except the evidence does not show that. Let me repeat that. The evidence does not necessarily show that there will be a decrease in the incidence of hip fractures if you take calcium, and some of the studies actually show an increase in the incidence. The United States Preventive Services Task Force that sets government policy here in the country, they don't necessarily recommend that people take supplements of calcium or vitamin D, and as we'll see later, they say the evidence suggests against it. There might be a slight increase if we give children calcium supplements, might be a slight increase in their bone mineral density, but just in children. But additional calcium doesn't seem to be justified. Now, where does the term postmenopausal osteoporosis come from? It comes from Albright in 1940. He introduced the whole concept. He said it was a result of hormone deficiency. He said in a population where the calcium intake is even very low, there was no poor bone health and no increase in the fracture rate. And because of his studies, the recommendations for calcium intake in the country went from 1,000 milligrams a day down to 800 milligrams a day. And as a matter of fact, in 1962, the Food and Agricultural Organization of the United Nations said, you know, when we look throughout the world, we find that an intake of calcium between 300 milligrams and 1,000 milligrams seems to be quite satisfactory. And as a matter of fact, the Food and Agricultural Institute of the Organization of the United Nations and the World Health Organization, they recommended the adult intake in 1974 should be between about 500 milligrams, so 400 to 500 milligrams of calcium a day. But then we had Dr. Heaney. Dr. Heaney is an expert in calcium physiology from Creighton University in in Nebraska. And he and his group found that calcium balance for premenopausal women should be about 1,000 milligrams a day intake, postmenopausal women about 1,500 milligrams intake. Now, subsequent studies by Hunt and Johnson and a group of other people showed that for men and women between the ages of 19 and 75, longer duration study, calcium balance seemed to be pretty much neutral between 400 milligrams and 1,700 milligrams calcium intake a day. And also that the calcium balance doesn't necessarily refer to the bone balance, but because of Heaney's studies, the concept was that, well, we're not getting adequate calcium. So in 1997, the United States and the Canadian government said, well, for women over age 50, take about 1,200 milligrams a day. In 2002, the Food and Agricultural Organization, the World Health Organization, they said that for postmenopausal women and women over age 65, probably about 1,300 milligrams of calcium per day would be an adequate intake. Now, at the current time, the recommendation is for women between the ages of 14 and 18 in the country, pregnant or breastfeeding or not, 1,300 milligrams, women between 19 and 50 years of age, 1,000 milligrams, women between the ages of 51 and 70, 1,200 milligrams a day, women over age 71, 1,200 milligrams unchanged from age 50 through 70 plus. On the other hand, in men, 19 to 50, it's 1,000 milligrams, stays that way 50 to 70, but in men over age 70, 1,200 milligrams per day. But there's a lack of adequate information, especially for people who are pregnant or lactating. It doesn't seem that extra calcium is protective of the bones. It doesn't seem that extra calcium has anything to do with the pregnancy. So the studies that have been done on bone loss and dietary calcium intake clearly show that there's no relationship at any site in most of the studies, and the evidence might suggest that the more calcium you get, the less bone density you have. Well, the Auckland calcium study looked at women who were taking in between 425 and 1,344 milligrams of calcium a day, and it found, number one, at onset of the study, bone mineral density didn't seem to make any difference whether the women were taking the low amounts or the high amounts, and on follow-up, the fracture rate was unrelated to the amount of calcium that they got. So, it seems that maybe we're actually not really requiring such massive amounts of calcium because there's no relationship in the rate of bone loss and one's ability to maintain good bone health once we get past around 300 milligrams. 300 milligrams is what they're consuming on average in Asia and in Africa. Calcium intake by diet, anywhere between 400 and 1,500 milligrams a day. Now, people after menopause are going to lose bone mineral density. There's no question that they're going to lose bone mineral density, but taking calcium doesn't seem to change that. The idea that the calcium supplements make the bones stronger and protect the bones and increase the bone mineral density and decrease the rate of osteoporosis and osteoporotic fractures probably is not true. Boland, in his diet studies, showed that there was no association with calcium intake and fractures either of the hip or the vertebrae or the forearm. Some of the studies, when we add all of the studies that have been done to date and put them all in the same pot, we do find that there may be about a 10 to 15% reduction in the incidence of fractures. But if we look at the studies that are unbiased, well, when we look at the unbiased studies, it seems that the fragility hip fractures are not decreased as we increase the amount of calcium that we take in our diet or as supplements. Other studies have shown that actually if we increase the amount of calcium, then we might increase the rate of hip fractures. Well, I think what we can say is when you look at the large studies, you look at the study like the Women's Health Initiative, looking at 36,000 women following for some period of time, the bone mineral density at the hip only slightly increased at best if women took the calcium supplements and the vitamin D, but it might have to do with the hormone replacement therapy, and indeed it seemed that the bone mineral density at the hip was increased in those women who took the calcium and the vitamin D if they were taking the hormone replacement therapy that's thought not to be a good idea anymore because it might lead to other kinds of problems, including breast cancer. So, when we look at the studies all together, you look at 17 to 21 studies, no reduction of the incidence of hip fractures. 7 of 8 studies show no reduction of vertebral fractures. 14 to 22 studies show no relation of the calcium intake to the total fracture rate. Observation studies, as I said, anywhere between 300 and 1,200 milligrams, probably okay. There was one study, 1993, Chapuis from France. He published a study that was looking at 3,000 some odd women who were ambulatory but living in nursing homes in France. These women were receiving supplements at 1,200 milligrams calcium a day, 800 international units of vitamin D, and he did find that there was a decrease in the fracture rate of around 23%. Found a phenomenal increase in the bone mineral density. But people have gone back and looked at the study, and the women in the study had such low levels of vitamin D that they probably had osteomalacia, not osteoporosis. Well, at least at the present time, I think we can say that the benefits of calcium supplements, if there are any, might be limited to people in institutions, not so much in community-dwelling individuals. Many of the studies have shown there's no evidence of a decrease in the incidence of fracture. And at best, we would have to treat about 500 individuals for over 6 years to prevent one vertebral fracture. And there would be a smaller benefit in people who were at lower risk. So the meta-analyses where we put all of the studies into a pot and we try to make some sense out of it, there's either no benefit or at best maybe a 10% benefit. But in the largest study, as I mentioned, the Women's Health Initiative, looking at 36,000 postmenopausal women, depending on how the data is evaluated, we find that the calcium supplements really don't seem to prevent any problems unless the women are taking the hormone replacement therapy. Well, the Food and Drug Administration says adequate calcium and adequate vitamin D is part of a healthy diet along with physical activity, and it might reduce the incidence of fractures later on in life, so that's a good idea. Well, how about when you take the bisphosphonates, you take the drugs like Fosamax, alendronate? Well, most of the studies have people taking the calcium supplements in addition, but let's look at the one study with about 700 individuals, follow them for 2 years, and these people were either taking the Fosamax by itself, the alendronate, or they were taking the Fosamax and 1,000 milligrams of calcium, and interestingly enough, there wasn't any real significant difference in the bone mineral density in those two groups. The women who took just the 1,000 milligrams of calcium, their bone mineral density hardly bulged. Now, the most important thing to realize is that the calculators of fracture likelihood, you can calculate them on your computer, they don't require any knowledge or any input of the amount of calcium in your diet. And as a matter of fact, in the last 10 years, there have been 5 large trials, and again, those trials don't show any benefit on calcium supplements for the primary analysis, and for the secondary analysis, some of them show increased incidence of fracture. So again, we don't have really good evidence for this fascination that people have with taking calcium. And it's estimated at the present time that about 5% of women take more calcium than the upper limit of tolerability according to the Food and Nutrition Board. So you have more of a likelihood of taking in too much calcium than you do in reducing the incidence of developing a fracture. So if you want to prevent fractures, get out and walk and run and do some activities where your feet come off the ground and hit the ground, work against gravity. That's how you prevent fractures. It's shown that sitting still for more than 9 hours a day is going to increase your risk of hip fracture by 50% compared to people who are less sedentary. Factors that are associated with osteoporotic fractures have to do with falling. So you're falling because you have impaired walking or impaired balance because you have arthritis or peripheral neuropathy, or you have postural hypotension from taking a medicine, or from growing old, or you have an arrhythmia, or you're taking sedatives or hypnotics or antidepressants, or your home environment isn't really appropriate. Maybe you have slippery floors, you have poor lighting, you have obstacles and clutter on the floor, you don't have any handrails to help you. So why do people have this fascination with taking calcium? Well, in part, it's because of advertising and Americans' love of taking vitamins and minerals and the idea that the supplements are going to make you strong and make you healthy. The ties of academicians to industry and to the supplement industry, specialist societies, advocacy groups. There's the idea that if you take more calcium, it's going to be very good for your bones. But, as I've said, supplements with calcium alone, not supported by the evidence, at least according to the expert consensus meeting of the European Society for Clinical and Economic Aspects of Osteoporosis and the International Federation of Osteoporosis. The United States Preventive Services Task Force says currently adequate evidence shows that there's no benefit for primary prevention of taking up to 400 international units of vitamin D and up to 1,000 milligrams of calcium for community-dwelling postmenopausal women, and taking greater amounts, there's still no adequate evidence that it's going to do you any good. Well, Journal of Internal Medicine, 2015, calcium supplements have very little role to play in the prevention of osteoporosis or the treatment of osteoporosis. International, the IOM, which is now called the NAS, they said that there's no evidence that people need calcium supplements. World Health Organization doesn't recommend calcium supplements. National Osteoporosis Foundation, they say that, well, you should get in about 1,000 milligrams of calcium if you happen to be a premenopausal woman, if you're a man less than age 70. They say you should probably take in about 1,200 milligrams if you're a postmenopausal woman or if you're a man over age 70. So where's the support for the calcium supplements? All I can say is that at the present time, for the overwhelming majority of Americans, there's actually no science behind the recommendation from your friends that you should take a calcium supplement. Just eating a traditional American diet seems to provide basically all the calcium you need. And as a matter of fact, the calcium you take in really doesn't correlate with your bone mineral density or even the likelihood that you're going to suffer from a fracture. Remember, osteoporosis and fractures are not synonymous. Most fractures unrelated to trauma are caused by falls. We need to reduce the incidence of falls. As far as taking the calcium, once you get more than 400, 500, 600 milligrams a day, certainly there's no evidence, and according to a lot of the studies, more than 300 milligrams is quite adequate. So anyway, I appreciate your watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified when we post new videos. As always, I appreciate your interest. I'm Dr. Ken Landau.